Hello, everyone. I just want to make sure that you can hear me. Can you please let me know in the chat if you're capable of hearing me? Great. Dr. Mucci, hello again. I want to thank you for giving us this lecture. And I want to say that the Mal de Débarquement lecture got a lot of praising. So we, Dr. Vivian, are you able to hear me?
Can you hear me? Hello? I think now I can hear you and you can hear me. Can you hear me now? Okay, perfect. Okay, great. Thank you.
So thank you for joining us today. And we're going to be talking about VID. So I leave you the floor and thank you again.
Thank you. Hi, everyone. Thanks for everyone that joined. Okay, so I will talk today about one of the aspects that people that suffer from sport-related concussion sometimes develop, which is visually induced dizziness, which is not something that it's, let's say, acknowledged or very well known. So I'm just going to give you an overview about sport-related concussion, some of the diagnostic challenge. Also, I'm going to talk to you about extreme sports, since I'm part of the Extreme Sports Med Association, and also about rehab, a different perspective. And then we're going to dig more into what is visually induced dizziness. So let's get started. I think most of you kind of know what is a sport-related concussion, but sport-related concussion is really a form of mild traumatic brain injury, and it can be caused by a direct blow either to the head directly or any other part of the body, which then results in a direct force which is transmitted back into the head and creates this kind of what we know as a mild traumatic brain injury. Usually because we define it as a sport, usually indeed happens during a sport activity. And we're going to also see that this is quite common, especially when we think kind of dangerous sport, contact sport, or also extreme sports. And it's kind of weird to think that it's so common, actually, massively in many, many activities and sports, especially involving also adolescents and not just adults. And you can find more about epidemiology in these two papers. So as I mentioned before, it can be either a direct blow or indirect blow, and usually results in a short-lived impairment of neurological functions that usually they can, in the best case scenario, resolve spontaneously. However, in some cases, these signs and symptoms are evolving and they not just resolve, but they become chronic and long-lasting. And these neuropathological changes, which are quite difficult sometimes to categorize because they're not really clear biomarkers, as we're going to see later, they can then lead to a complex mix of symptoms, which we classified as post-concussion syndrome. And this is really when patients, they can be also then developing what we can more directly see also with vestibular problems. So if you have sport people, either young or adults, playing any contact sport or extreme sports, one of the things that sometimes used in the field is the SCAT5. So any athletes that is suspected to have a concussion usually gets removed from the field immediately. And also they kind of try to give more direct guidelines to the medical physicians team of the sport team, or even just to coach to what to do if that happens when there is a game or if you are in an extreme setting. So usually it's always recommended that if a concussion is suspected, there should be someone taken to a medical facility if there is no medical doctor there or no specialist that knows about concussion symptoms. The athletes should be refrained from drinking alcohol or taking recreational drugs, as you can imagine, or also drive. Concussion signs and symptoms evolve over time, so it's really important to take and tracking how the symptoms evolve from the heat and from the incidents onwards. And then indeed the patient should be again consult a medical doctor for a clinical real judgment. So these are really the 5 principles of, you know, the first aid, how dangerous it is, the airways is responsive, is unconscious, and usually again is recommended not to move the athlete, not to practice anything that could also endanger the spinal cord if there is a more serious injuries, and to really not remove if they have any helmet or protection. This is kind of the general knowledge that happens when from the SCAT5. This is probably you've seen it, and if you collaborate with athletes is always good, especially for athletes that are in solo and they practice but not in team, to have a general idea so that they can then consult a medical doctor. But really, how do we recognize concussion? So, okay, the biomechanics we just mentioned, I can be because indeed the patient reports, oh yes, I hit my head, so it's clear, there is a sign. But sometimes there are also other things like physiological disrupted brain functions, which can result with neurological changes. And also clinically, it can also be with a range of clinical signs, which we're gonna see in the symptoms and signs. Sometimes also, of course, involving the vestibular inputs, like posturography may change. They have difficulty in gaze stabilizations, and we're going to see more details later about this. Neuroimaging, now there are more and more studies focusing on the neuroimaging related to mild traumatic brain injuries, and thank God so, because it's so difficult to diagnose it that indeed if neuroimaging would be able to detect some of the physiological abnormalities and clinical features that these patients present, it would be much easier to give them a proper diagnosis. So this is something that's in developed, and I'm going to just mention something briefly later. So also fluid biomarkers and genetic, there are a few studies on there. But really, what is the important to recognize is that we don't really have a clinical biomarker to say definitely this is a concussion or something else. So the concussion equation, this is something that I found it quite interesting, because indeed it shows the complexity and at the end how many symptoms can lead to balance as well as cognitive functions, their compromise as well as the emotional part. So it's really a type of incident that doesn't really regard only one discipline in medicine, but it's really requiring a multidisciplinary approach. So some of the signs and symptoms, even if you may know this, I'm just going to go through quickly. The cognitive part, the fatigue, sleep, dizziness, blurry vision, diplopia, irritability. There are many more that I haven't mentioned here in terms of personality, apathy, and all the secondary mood disorders associated, as well as photophobia, phonophobia, as well as many obvious clinical signs that result also from a vestibular impairment. So the diagnostic challenge, and sometimes concussion and mild traumatic brain injuries are really defined as a silent epidemic because there's so much unnoticed, and they can have profound consequences, especially in athletes, since they work basically by using and improving their performance, but also in general in the society, because they're sometimes missed, not diagnosed, and they can lead to mental, social, as well as economical and occupational sequels. So it's really important that we improve the diagnostic challenge. The diagnostic challenge, when we think about extreme sports, why I want to talk to you about extreme sports is also because extreme sports is not something that sometimes people think, oh, but who does extreme sports? Actually, you'll be surprised. There are many studies from the 1960s till now that they show that extreme sports participants have grown exponentially. And this is happening because there are many theories. It might be because the society is just because they became more accessible, or because some people, they call it adrenaline junkie. This is all another terms of discussion, but they are not so uncommon. And actually there are many people, especially among young adolescents, that they practice them. It can be even skateboarding or snowboarding. It can be base jumping, many different sports. They are under the category of extreme sports. And when we think about these sports, it becomes even more challenging because sometimes they're indeed done either in a setting where there are no equipments for monitoring, or even without any people around, so they're completely left by themselves. So it's really important, because there are no pitch screening like the SCAT5, that the athletes themselves, they get the knowledge what to look for if they get a concussion. So what happened after concussion? As I mentioned before, in the worst case scenarios, between 7 to 10 days, either the children, the adolescents, or anyway, younger people even quicker, but let's say also adults, they recover from a concussion and they kind of feel slowly going back to normal. However, when people develop the so-called post-concussion syndromes, the symptoms persist for initial more than 2 weeks, and then the athletes, they're unable to return to the normal function. This is really important to define a type of period, because some athletes missing the first concussion or not having guidelines on when to return to sport, they return to sport too early, and then they get another concussion and then another one, because they keep training, keep playing in contact sports, unable to know when they should actually still be in the recovery phase. So the maltraumatic brain injury is still present both in 3 to 11 years after an injury event sometimes. So there are very serious long-term consequences if it's badly treated. And on the other hand, it's not something that can remain permanently, because we know we have this amazingly ability of neuroplasticity, so to readapt. But it is really, really important that the people are educated on what to do. There are many clinicians and physicians that have not updated themselves on what to do with the new guidelines for sport-related concussion, which they're not to recommend your patient to be in bed for a month. That's something that unfortunately I've seen for many times, and that's not really something that it's really, let's say, good for the patients. So what can be done to help the patients? So in extreme sports is really important in that we educate the athletes that this type of sports, that we call it, let's say, untraditional and independent participations, they know how to recognize the signs. I just want to give you some more numbers. When we think of these type of activities, there are around 40 million injuries occurred in extreme sports. 11.3 were head and neck injuries. So it's really, really prevalent. And you can see motocross, skateboardings, anything related to snow sport, they're very common and not to underestimate. This is again the risk of suffering from concussion. The highest sport was snowboarding and skateboarding, which is fascinating. I didn't know that. So when we think about what can we do for the patients, so in terms of the best approach is always to have a team of experts working together. So to have a multidisciplinary approach, an approach that will involve vestibular expert as well as expert in oculomotor dysfunctions, head and migraine expert in terms of psychology and how to approach it, especially if they're athletes, experts that are able to work on cognitive rehabilitation. So it's really a multidisciplinary approach, and this seems to be working really the best. But if we look into a vestibular focus and approach, and we move more into the expertise of the vestibular field, we know that when patients have a concussion that either comes from sport or normal concussion, often they can develop dizziness as a post-traumatic dizziness. And that can be because either a trauma to the peripheral vestibular end organs, or because of also just the multisensory integration, which fails on a central level. And then of course there is always associated anxiety has a secondary aspect of concussion. So sometimes it really becomes challenging to distinguish if the patients have really a psychogenic mechanism to trigger the vertigo or the dizziness, or if it's something that really has a real dysfunction. So it's very important to take into account and distinguish and perform the normal diagnostic if it's peripheral or central. And taking into account that sometimes peripheral injuries like canalolithiasis are very, very common when there is a head trauma, just because of the blow of the impact. And also it's very important to consider labyrinthine concussions, which is like accessory neural hearing loss, which has many manifestations, also like vomiting, nausea, and that can resolve with adaptation. So just by leaving the patients, you know this probably better than me, is also important to acknowledge that some of these patients, they have many lymphatic fistulas, which needs to be addressed. So it's really important to indeed, obviously just receiving a clear diagnostic. And also it's important to have a if we look at the central part, to have a central vestibular symptom, which what are most common, which are the pathways that have been engaged, which are the symptoms to develop migraine-like symptoms, so that the patients can then be either given the right medications or follow a type of rehabilitation. So whole part of the brainstem and cerebellum can be affected. And something important that came out of some research was that the mesencephalon part some way was more affected than others, usually during mild traumatic brain injuries. And of course, the symptoms of central regions, you may know, they're very similar to other vestibular problems, so less short imbalance, dizziness, sometimes nausea, confusion, brain fog. These are all very common symptoms. So the vestibular test battery for head trauma should really be like a normal vestibular test battery, so including smooth pursuit, saccade, VOR, horizontal. I mean, pretty much the typical vestibular test battery that is done.